everyone. Welcome to Pointe Counseling. We're an outpatient facility that's located outside of Atlanta on 3188 Atlanta Road in Smyrna, Georgia. We're about 15 minutes from downtown Atlanta. Today I want to talk to you about change in terms of alcohol, substance abuse, and what the process includes in terms of going from active using into recovery. It's a complex system where patients tend to struggle with this whole idea of changes. And what we're going to do is use Prochaska and DiClemente's stages of change. And it's something that the researchers have designed some years ago. And we're going to walk through these different stages, trying to understand what stages does our patients actually go through. And so the first stage they came up with is the pre-contemplation stage. And basically this is a stage where someone is actually living their lives, no indication that there's any drug and alcohol issues involved. So what tends to happen is this person here is developing their own certain lifestyles, their beliefs, and the value system. It's easy to call this the kind of pre-morbid. Essentially, this person is not expecting to end up in an addiction issue or expecting to end up in treatment, so they have absolutely no idea that anything is wrong. And so as their lifestyles, the personal belief system, the personal value system that they have is evolving. And so what you have is casual use of the drugs and alcohol. There may be some small minor indication where they tend to be drinking a little bit more than their friends or family members, and friends and family members may start to notice, identify that something may be out of the ordinary. Once again, it's not an issue, it's the pre-contemplation stage. And so we can basically say at this particular stage, the person has actually no evidence that something is wrong. And once again, keep in mind that the pre-morbid stage is nothing is wrong, no one's feeling sick, there's no complication with lifestyles, etc. And so as the drinking and drug use increases, and we've come out of the biomedical model knowing that the more a person is using drugs and alcohol, the more tendency for them to increase the tolerance, and so they're going to need more of the same substance just to get the same high effect. So what happens now, they're moving into stage 2, which is the contemplation. Some signs and indications that maybe something's wrong. The drinking is increasing, the drug use is increasing, and it's a little bit more than what the friends and family members are used to. There may be some subtleties such as anger outbursts, deregulation in their work agenda, missing work, getting up late, having some hangovers here and there, and staying out late in the middle of the night. And so there's some evidence that something may be wrong, but not enough yet to say, I need to go ahead and get some help, and I need to get some treatment. But the evidence is pretty clear. Now this is the blind spot to the patient. The family members are noticing that something is wrong, so they may start to indicate to the particular individual that you may want to slow down a little bit. You may want to watch how much you drink. Now you're causing a scene when we go out to eat. You're causing a scene at home. You're kind of destroying our vacation time. There's some evidence the person here may be thinking about it, but not sufficiently. And but the evidence is building. Some relationships starts to get disrupted. In order to manufacture their day, it's not happening as easy as they used to. So life continues. And I also want to point out here too that these lifestyles, belief systems, and value systems are still emerging. And one of the dynamics is that in the contemplation stage, where there's some evidence that something may be going on, the person may start to address certain associations with their drug use and alcohol use, meaning that they're building a relationship, a unique relationship that they're going to have to possibly pay the price for later on in their treatment, because they're developing certain perspectives and a view of the drug, such as the association. One example may be, it helps me to sleep at night. It helps me manage my stress, helps me deal with difficult situations, difficult scenarios. When I come home from work on a Friday, this is the way I reward myself and have fun. When I'm having a wonderful time, a celebratory, for example, drugs and alcohol play a part of it. And so what's happening here is that physiologically and emotionally and psychologically there's an emergence of marriage that's taking place between the substance and the person's psyche. And we're going to revisit that later because that's going to be one of the major roadblocks for them to kind of change their belief system that they're developing over here. And we have the beliefs as well as the value system. And it's being reinforced. It's being reinforced by the drug use. Now, as the progression of the drug and alcohol increases, the ability to function on a daily basis becomes more impaired. So the daily functioning now is giving more evidence that this person is unable to manage the amount that they've been using. And so, yeah, at this particular stage it's saying that I do have a problem, but I'm not ready yet. And so what happens is you have this denial system starts to set in, and also the reinforcing of the lifestyles, the beliefs, and a certain perspective on the drug. There may be some disruptions in the relationships. Now there's a lot of evidence on both behalf of the patient as well as the family members and friends who are looking on and saying, okay, we have enough evidence, we need some help. And so you have a disruption in the relationships, more impairment in the daily functioning as being a parent, as a worker, and also mood, sleep, appetite, maybe having issues around depression, maybe having issues of anxiety. So what this person would tend to do is go back to here where they start to make these significant associations with the drug and alcohol, and they're going to use it even more as a medicinal approach to manage the stress, the arguments, the dysfunction in the marriage, the depression, and most importantly, what we hear quite often in our treatment center at Compass Point is that it helps me sleep. Well, as we know with chronic alcohol and drug use, there are basically two stages of sleep. You have the REM stage, REM, which is rapid eye movement stage, and then you have the slow sleep wave, and the slow sleep wave is where we get our restful sleep. The person who's now in chronic alcohol and drug use, they're not getting any, at least sufficient amount of the slow wave sleeping, so they're getting exhausted even though they think they're sleeping, which really we call it passing out. Determination, I'm determined to get some help. There's a problem, I see it, I'm waiting for the right time. Also, what's happening at a really substantial level is that the rewards of the drug and alcohol use is coming down. So you have a relationship between the rewards of using versus the consequences. At first, the rewards were pretty high. Having a lot of positive feedback, we call it a positive incentive value of the drug and alcohol, meaning that every time I use it, I get high, it works. And I have this sense of euphoria, I get buzzed, I have a lot of fun, a lot of excitement. So that's the rewards of the drink and drug use. Consequences are pretty low. At the contemplation, we can now see the rewards are coming down a little bit, and the consequences are getting quite higher. At this particular stage, people are still not willing to check in for treatment. Why? Because they're still able to manage the drug and alcohol use, and this managing of the drug and alcohol use has come back to get them later on, because what they're doing is reinforcing that I can manage this substance abuse on my own. As we get into the determination phase, where I'm actually sure that there is a problem, meaning the rewards are pretty low, and the consequences are pretty high. People normally check into treatment when they're running out of rewards, and the consequences too great. Could be legal issues, could be ultimatum from spouse to get help or else we lose this marriage. It could be health problems. It could be psychiatric illnesses that's attached to the addiction, and at this point now, we need to get some help. And this is what Maslow calls, Abraham Maslow, the psychologist, he calls it being manipulated to get some help. Not inspired, just manipulated from external forces. And so now we're into this important phase called treatment, where I have a problem, getting some help. Very important transitional stage, because now we're moving away from wondering if there is an issue into the fourth stage, that I do have an issue. This is where we call the transformation takes place, meaning that now these value systems, the relationships, the belief system, the lifestyles that's been developed and rewarded and reinforced, now we have to check them in the action phase. And so the action phase is simply saying it's now time for treatment, and there's going to be a massive debate going on with the patient, an internal dialogue saying, what do I need to change? And so inside here is there's going to be a re-examination of the view of myself. Who am I? How did I get to this point in my life? Do I really have this issue? How do I picture myself now, calling myself an addict or an alcoholic, which is a pretty difficult pill to swallow. I now have to view my others, my relationship, my loved ones. Because now they're part of the system as well. They've been affected by the fact that national statistics are going to show us that 55% of our loved ones who are involved with someone with an addiction end up with symptoms of depression. And so now we have a change of view of our relationships and also view of our world. The environment we lived in. We're very comfortable in our environment, and that's why we're able to develop a certain lifestyle, beliefs, and value systems around our lifestyle and around our worldview, and we reinforce them here, reinforce them here. All of a sudden now, this is where the conflict happens, and the conflict means that I'm coming in for treatment, I'm coming to change, and so I've been kind of like a tidal wave of this momentum going full speed, and all of a sudden comes to a screeching halt. And treatment centers around the country, they make this drastic mistake saying that patients got to change, but not taking into the fact that this is not an easy task. And for some, it may seem an insurmountable task because all of a sudden now, everything I believed in has got to be changed. And it can also be a very frightful and very fearful experience because sometimes I feel threatened that if I don't make sufficient amount of changes soon enough before I'm discharged out of my program, I'm in trouble. And so you have this action phase. This is where we start to implement the new tools that I'm going to be getting in treatment, and how do these tools apply to my lifestyle. And so the mistake may also be made that if I try to take my tools and apply them to my lifestyle, or take my lifestyle and apply them to my tools. And so that's going to be a conflict that individuals are going to struggle with for a long time. As the action stage moves forward, now we're going into the maintenance. The maintenance part of it has to do with, now I've got a sufficient amount of tools. I've reevaluated myself, my relationships, my world, my environment, but also I had to change my view of my drug and view of my alcohol. This got to change. Remember now, you've developed a certain perception on what the drug and alcohol meant to you, how it evolved in your relationship, how it evolved in your life. All of a sudden now, you're going to have to change your perspective of it. And so what I had mentioned earlier, that the information and associations you've made is going to come back to get you, because now you have to go back and try and rearrange your perspective and your worldview on your drug. You're still going to be living in the same environment with it. You're going to be in the same relationships. You're going to sometimes even have the same friends. So you have to reevaluate my perspective of this drug and alcohol. The tools we get here. Now, there's going to be a debate, because people in treatment have a tendency to say, how much of this old self do I bring into treatment and then take into recovery? And so there's an internal debate going on. And as we take these tools, we go into the maintenance phase. The maintenance phase means that I'm ready now to apply the things I've learned. And I'm maintaining a lifestyle. Now, most programs talk about relapse as a part of recovery. I simply disagree with it. Okay, relapse does not have to be a part of recovery unless you make it an option. If you say relapse is a part of recovery, it's a choice that you're making. If it's not an option, it's not an option. So don't give yourself that option to say relapse is a part of recovery, because you're setting yourself up for it. And Prochaska and DiClemente's scheme they say relapse is a part of recovery, so the person would then transition into maintenance and then into a relapse, and then possibly start this process all over again. At Compass Point, what we suggest and strongly teach our patients that you move from the maintenance part of it and develop that into a lifestyle so you can get out of this system of change. And so where we are saying here, I'm being manipulated to change by external forces. Now I am inspired to change. I want to change because I want to change. It's coming from internal. This is external motivation to change, internal motivation to change. We don't consider relapse an option, so it doesn't happen. One of your greatest tools you're going to have in recovery is your choice. You decide if that's going to be an option. If it's not an option for you, you think about all of the pain and suffering that was happening here, where your consequences got extremely high and your rewards were extremely low. This is still waiting for you if you decide on a relapse. Once again, if you decide on a relapse, it's an option that you're going to invite the relapse back into your process, or you're going to choose not to have it part of your process, and we get you out into lifestyle maintenance. That's just a quick snippet. I want to thank you for listening to Compass Point Counseling. Thanks.